So good afternoon, sir. I'm Rachel A. Cabanban and I am your nurse for today and I will be performing the 12 ECG or also known as electrocardiogram. The first thing to do is review the patient medical record and plan of care for information about the need for ECG. The purpose of this is to monitor the conductivity of the heart of the patient. The next is keep the patient away from the object that may cause electrical interference such as equipment, fixtures, and power cord. So let's check. Next is inspect the patient chest for area of irritation, breakdown, or excessive hair that may interfere with electrode placement. So before that, we should ask permission of the client. So, sir, I will expose your chest. Would you allow me, sir? The next is assemble equipment. Place the ECG close to the patient bed and plug power cord to the wall. Remember the correct color of the ECG. First is the red, second is the yellow, third is the green, fourth is the brown, fifth is the black, and lastly is the violet. Then for the arms, it is red and yellow. Then for the leg, it is black and green. The next is perform hand hygiene so that prevent spreading of the microorganism. The next is check the patient if it is correct. So, sir, what's your name? Then check the patient if it's correct. Next is explain the procedure and it's important. So, sir, as I said earlier that the ECG is monitor the conductivity of your heart. Also to test if it is normal or not. The next is provide client privacy. Next is position the client in a comfort. So position. Is instruct the client to keep still in bed and refrain from talking while the procedure is going on to avoid any distraction. So next is plug the ECG machine properly. Do not forget to properly ground the machine. Then next is attach the limb leads to the client's extremities while the patient is lying flat. Then for the arm is color red at the right. Before that, place a electrogel. Then place it to the right arm of the patient. Next is the color yellow. Put another electrogel. Then place it to the left. Next is for the legs. It's the color black at the right part leg of the patient. Next is the color green. Then place it to the left. Next is expose the client's chest for placement of precordial leads. So first is for the V1, which is red, at the right side of fourth intercostal space of sternal border. So first apply the electrode gel at the right. Then 1, 2, 3, 4. Then place. The next is the yellow. At the left opposite of V1 at the left sternal border, fourth intercostal space. Then apply the electrodes gel. Then place it to the left. 1, 2, 3, 4. Then before we are going to V3, we will going to put first the V4, which is color brown. At the 5th intercostal space, mid-clavicular line. So draw a line, and actually below the nipple. Color brown. Then 1, 2, 3, 4, 5. Then place. The next is the green, which is the V3. We will place the green in between the V2 and V4. V2 and V4. So apply the electrogel first in then place it. Then next is for the V5, which is color block. Back to clavicle, going to the anterior clavicle. Line the same with the 4th intercostal space. So 1, 2, 3, 4. By applying the electrode, you should apply first the electrogel, then place it. Then next is the V6, which is the violet. Place the mid-axillary line. Apply the electrogel, then place it. So next is turn on the machine and obtain the tracing leads. ECG may be obtained without removing the precollegial leads. So let's turn on. Then next is disconnect the lead swipe excess electrode paste from the chest end wash. So first we should remove first in the chest. And then wipe it using the ghost pad. Next is for the arm. For the arms, then remove. Then write significant data without the patient on the strip, like data, time, name, age, sex of the patient, whether it is male or female, then vital sign. The result of the patient is right on the back of the ECG paper. Then name. Okay, that is for today.